An 18-month-old boy presents for evaluation of poor weight gain. He was born at 33 and 2/7 weeks gestation. His mother's pregnancy was uncomplicated except for a 2-week respiratory illness. He still breastfeeds and eats produce, grains, and meats. He avoids cow's milk due to his mother's allergy. He had vomiting and diarrhea for 2 days last week but is otherwise healthy. His weight corrected for gestational age is less than the 3rd percentile. He appears thin and mildly pale with no dysmorphic features. The only lab abnormality is a slightly low hemoglobin. Which of the following is the most important risk factor for this patient's condition? Option A, avoidance of cow's milk. Option B, premature birth. Option C, recent illness. Option D, maternal infection. Option E, prolonged breastfeeding. Take 10 seconds. Weight below the 3rd percentile corrected for gestational age. This is growth faltering. The child eats a variety of foods. The recent illness is resolved. The maternal illness was uncomplicated. One factor in this case stands out above all others as the underlying driver of poor growth. The correct answer is B, premature birth. This patient has growth faltering, defined as weight below the 3rd percentile when corrected for gestational age. Premature birth is the most important risk factor. Premature infants have lower birth weights, increased caloric needs, and face significant challenges in achieving adequate nutritional intake. Being born at 33 weeks places this infant at high risk for ongoing growth difficulties. Avoidance of cow's milk is not a significant risk factor here because the child is receiving adequate nutrition from a variety of other solid foods. A recent illness such as viral gastroenteritis can temporarily reduce weight gain, but this is transient. It resolved 2 days ago and is not the most important underlying risk factor. Maternal infection during pregnancy, such as toxoplasmosis or syphilis, can affect fetal growth. However, the mother's respiratory illness was uncomplicated. The pregnancy was otherwise normal, and there are no signs of congenital infection in this child. Prolonged breastfeeding without complementary foods can contribute to growth faltering due to inadequate caloric intake, but this child is already eating a variety of complementary solid foods. Key testing point. Growth faltering is defined as weight below the 3rd percentile corrected for gestational age. The most important risk factor in this case is premature birth. Preterm infants have lower birth weight, increased caloric needs, and difficulty maintaining adequate nutrition. Other risk factors include congenital infections, drug or toxin exposure, anatomic anomalies, neuromuscular disorders, and psychosocial issues such as poverty and maternal depression. Follow for daily board questions.